Are you currently suffering from pain that's just under your kneecap, and the pain gets worse as the level of intensity of the exercise increases? These are common symptoms of patellar tendinopathy, or more commonly known as patellar tendonitis, affecting that big tendon of your knee complex. And we're going to show you how to actually know what this is, the best rehab protocol to address it, to get you out of pain and back to activities that you enjoy. For those that are new to our channel, my name is Dr. Zach Greenwade, and our mission is all about empowering you through education, exercises, and ways to self-manage your own conditions. The patellar tendon is in the knee, and it runs from your kneecap or patella down to the shin bone. But this can also affect the quad tendon that goes from your thigh or quad muscle to the top of your patella or kneecap. This is most common in 15 to 30-year-old males, but anyone of any age can experience it at some point. And it's highly prevalent in athletes, especially sports that involve a lot of jumping, such as basketball, volleyball, football, or soccer. If you'd like the video, subscribe to our channel, and then don't forget to turn on notifications. Now we're going to cover the 4 cardinal signs or symptoms of patellar tendonitis so you know exactly what you're dealing with. So number 1, the pain is very localized or specific to a region that's just under the kneecap, or less commonly just above the kneecap. Number 2, the pain is load dependent. What we mean by that is the more you lift or the more intense you exercise, the worse the pain is going to be. For example, the pain will be worse at squatting 225 than 135. Number 3, the pain usually gets a little better as you start to warm up. Number 4, there's usually less pain or no pain at rest. Unfortunately, with patellar tendonitis or other tendonitis, it can lead people to think that inflammation is the main culprit. But unfortunately, it's more about mechanical overload or overuse. If you place this much load on a tendon that has this capacity, bad things are going to happen. And this can be more of an acute sense of just a few days or weeks, or it can be a much longer period that causes structural changes to the tendon that can be harder to rehab. We're now going to cover the rehab portion of this video. We broke the exercises into 2 levels, level 1 and level 2. Recommend everyone start at level 1 and then progress to level 2 as their symptoms allow. Seated band isometric. So in a seated position with a heavy band anchored behind you, place your shin in it and then press your shin away from you and hold tension. Start at 20 seconds but increase over time. Some discomfort is normal. Single leg banded squat. With that heavy band anchored, place one leg in it. Lift your other leg up. Squat down to tolerance. You can use your hand to assist you initially. Some discomfort is normal and work up to holding to 45 seconds. Level 2. In that seated banded position again with the band anchored behind you, place your shin in it, and this time with a slow tempo of 2 or 3 seconds, press your leg out as far as you can, pause for a second, and then return to the starting position for 2 to 3 seconds. As you get stronger and the pain decreases, try to press your leg out farther and farther from the starting position. Slow tempo lunge. With the affected leg in front, we're going to lunge down for 2 or 3 seconds, pause, and then return to the starting position. Over time, try to increase the depth. To make this more challenging, we'll progress to a Bulgarian split squat where your rear leg is elevated up on a box. Again, a slow tempo of 2 to 3 seconds down, pause, and then return to the starting positions. To make it more complex and challenging, hold to weight as we demonstrate here, and again, slow tempo is necessary of 2 to 3 seconds down, pause, return to the starting position. Accessory exercises. It's important to address the calves and hamstrings. So for the calves, start in a calf raise, raise up onto your toes for 2 seconds, and then return to the starting position. Again, feel tension in the back of your legs. To increase the difficulty, progress to a single leg version, and then lastly, hold weight in the single leg version. For hamstrings, lay on your back with your legs slightly bent and raise up. If it's too challenging initially, bring your legs closer. Over time, to increase the difficulty, lift one leg up and proceed with just one leg on the ground. And since this patellar tendon is an energy storage tendon, we have to return to jumping and hopping. So we're going to show you a nice protocol to do to kind of go from weightlifting back to sports. So the first version is just jumping on both legs with your knees slightly bent. The second version is in a split stance squat, jump, again letting your knees kind of bend. The third version is a single leg, again bending your knee as you're hopping and landing. And the last version is called pogoing. So when you land, you're trying to keep your knee as straight as possible. Now this increases the force a lot, so be careful and just go slow. With tendon rehab especially, dosage is super important. And so we're going to give you some parameters to help know whether it's something exercise that's kind of painful is safe or whether you should stop. So think yellow light is caution, go slow, and red light is stop. So with tendon, during the rehab, some discomfort is normal. You should expect some. It's not going to be painless. So we would suggest that 3 to 4 out of 10 or mild pain during is safe. Any symptoms that you feel that have increased during the exercise should dissipate within 2 hours of the exercise stopping. And then lastly, the next morning you should wake up and feel no worse off. If you're limping or the pain is worse, you did too much, you let your symptoms calm down and then start at a less intense level and then progress. That's it for today. We hope you found this video helpful. If you did, please like our video, subscribe to our channel, and we have a bunch of other great videos on other conditions that you should check out.